Okay. بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله أشرف الأنبياء والمرسلين. Welcome everybody to Sesame webinars series. Today we have an exceptional guest. Is one of the pioneer in medical educations in Saudi Arabia. She has lots of publications. I was doing a little bit of midline search, and I found that there is like more than 500 citations of her publications. It's my honors and Dr. Shazia with me on behalf of Sesame Riyadh office to welcome Dr. or Professor Rania Zaini. She is associated professor of medical educations at Al Qura University. She has a PhD in medical education. She is one of the leaders of the task forces who formed the competency framework, Saudi MEDS, which is becoming an important competency for undergrad in Saudi Arabia. Dr. Zain is interested in curriculum formulations, developments, as well as assessments. However, today she's going to talk to us about a topic which is becoming really very popular in medical education. Lots of master degrees, they included this in their curricula. Prof. Raniash is going to talk about artificial intelligence as physician competency in artificial intelligence and necessity for today's and tomorrow's. And we are going to learn in this webinar the impact of artificial intelligence on healthcare, as well as how the artificial intelligence is going to improve the patient's outcome. Without further ado, feel free to ask any question, put it in the chat box or raise hand, and we're going to leave you to talk and maybe discuss your questions with Prof. Rani. Without further ado, I'll ask Dr. Zaini to take the lead and start our presentation. Thank you very much.
Thank you, Prof. Ali. Shukran, Dr. Shadi. To start with, we talk about AI in medical education, a catalyst for innovations and excellency. We start by discussing the impact of AI on healthcare, identifying opportunity to leverage AI to improve patient outcomes, discussing the readiness of healthcare professionals, how to integrate AI effectively into medical training programs. So, in simple way, we will start what is AI. Artificial intelligence is a simulation of human intelligent process by machine, especially computer system. The Royal College of General Practitioners just identified as the technology with ability to perform tasks that would otherwise require human intelligence in a simple way. So AI system can analyze data, can recognize patterns and learn from experience, and most importantly, make decisions based in the information they process. So this is what is AI. It has different components that actually make the AI. The machine learning component, that how the algorithm, how the computer can learn things, can do things without programming based on the experience that they are going through. We have also the natural language processing, that now the ChatGPT, how the computer can recognize and interact and interpret the human speech, okay, and language and written and speech, and how to analyze the speech and language that has been written material has been given to and process this. We have also the robot that just designed to perform specific tasks, and we have the vision, how the computer can analyze pictures and can analyze objects and identify these. And finally, we have the expert system, how we can build a system based on the expertise data. Okay, so the system have the data, compare the data, and they can give a decision based on the data has been stored. So this is the expert system. So all of these consist or make the AI. Actually, in daily life, we are surrounded with all technology that has a component of artificial intelligence. So in driving, navigating our road, going to our works, doing the biometrics that you are attending in your workplace, doing ChatGPT, asking something. So everything surrounding us is just has been affected by artificial intelligence applications or algorithms. It has been affecting different factors in the finance, how we can predict, how we can identify fraud, how can we give predictions for the stocks. It is changing the transportation sectors by the automated governance transportation system, change the educations, the adaptive education technology, the augmented reality technology. Everything has been changed. The customer service actually face has been changed. The entertainment sectors, tourism has been also changed. The most affected, yeah, or the least affected actually, is the healthcare. Okay, the healthcare sector has been also affected. It's not affected because it's a privilege. It's not affected because we decide to use it. No, actually, it's affected because we find ourselves in this. So, for example, the whole management system that bring to the hospital has a sector or segment of artificial intelligence. So, for example, the virtual assistant for health recordings, okay? Or all the technology that in the hospital, including different devices and equipment like the ECG, okay, has features of AI. So the deep learners can learn and identify the different algorithm and give you ECG analysis or X-ray analysis. It has been introduced, this segment or these features of AI has been introduced to the devices and tool and technology that we use in regular daily practice. The most important things is why now? Why we talk now about artificial intelligence? Why we talk now about adopting these? Because it's available there. Okay, it has been supported with advances in NLP. Okay, and it's supposed to change the face of medical practice, and that means it has to change the face of how the practitioner is supposed to do their own practice or perform their own regular tasks. It has the capability to do things faster, easier, and more efficient than human. It has the feature to have data-led decision making to minimize the cognitive bias or the rules of thumb. It has the data to have an access to large huge quantity of data and analyze them repeatedly, rapidly, and more efficient than a human capability. So it's there. So this is why it has been affecting the medical practice. This is why it has affected the medical practice in some places, okay, in some health facility, but not other, because it's there, but it's not utilized. And the technology, as anything in the life, use it or lose it. Okay, rules. So AI in healthcare actually is produced to assist healthcare professionals in diagnosing disease, in planning treatment, in predicting outcomes, and most important things, in managing population health and promoting health rather than just handling and treating disease and illness. It has a opportunity to improve the patient outcome. As we can notice, all of these support the patient about the telemedicine, for example, the telemedicine enhancement. It improved the accessibility to the healthcare service. The remote monitoring that wearable devices. Okay, it gives you more accurate, more efficient data, and that can help you to detect early abnormalities. The NLP is a feature that actually available in this patient recording. So it doesn't require anyone or any effort to analyze data that has been documented. Actually, the NLP will do this for you, analyze all the clinical documentations, patient notes, and give you an insight and decision, and sometimes just identify some trends. Uh, and mostly we have now the CDSS, the Clinical Decision Support System, that has been designed for some disciplines, okay, like for the um, cancer research, okay. So it has been designed to help the doctor making evidence-based decision, providing relevant information, relevant data, and recommendation. So all of these actually has available, okay? I can say available in the hospital, available in the practice. Now, how these affecting the role of the doctor in the healthcare? One thing that we have to understand, we have different international agency outlining the framework or the rules of the health practitioners and doctor in a specific aspect. Okay, so the competency framework outlined the whole framework competency that required by the training programs and by the graduate by the end of these training programs. We have the ACGME 6 project that has been developed, 6 competency that have been developed in the 1980s, something like that, about patient care, medical knowledge, professionalism, system-based practice, practice-based learning and improvement, and interpersonal and communication skills. And we have the CANMED developed in 2003, I believe, about the 7 domains of leader, communicator, collaborator, professional, scholar, health advocate, that all around the medical expertise. We have the Saudi made design in 2015-17, the final versions that outline the competency required by the graduate medical school in Saudi Arabia. And recently we have the memory commit, okay, that has also designed for this purpose. So all of this framework actually designed to have a competent physician practitioners, okay, in different levels. But are these competent practitioners now is competent in front of the era of artificial intelligence when it has been implemented in healthcare? So application of AI in healthcare actually has different aspects. It includes drug development, medical diagnosis, clinical treatment, personalized medicine, health advocacy, predictions, analysis predictions, gene therapy, gene editing, okay, a lot of things, health monitoring, wearable devices, all of this has been available now. Okay, and as I told you, it's nothing that we brought to us to be utilized. Actually, we find our system, our healthcare system, using a feature of this AI. So it has a promising aspect in improving diagnosis and treatment. But how is the doctor ready to use this to improve their diagnosis and treatment based on the artificial intelligence uh, applications? And to improve the efficiency and automations of all work routine tasks. Okay, it helped to predict analysis and make personalized medicine, predict disease outbreaks, predict patient outcomes, and design a specific personalized medicine based on the genes, once on the environment. Okay, the telemedicine and remote monitoring, how it has been facilitated to empower the patient in different place, and finally how the research has been enhanced. So the question, all of this promising aspect, does it really has been utilized with by our own physician, uh, resident and consultant in the workplace? This is the question to be asked. Here, different roles of different roles of AI in clinical settings. As I told you, the telemedicine, the patient engagement, and the research and development. So the question, again, going back to the same questions, so all of these technology has been augmented with the clinical practice. Actually, it doesn't just change the face of medical practice, it also changes the face of what is required by health clinicians, nurse, pharmacists, all the health professionals. The most important things in around in this technology, we have new graduates, new trainees, new residents, new fellows. Okay, and actually they are not facing. It's not easy for them to acquire all of this technology and implement all of this technology in their own routine practice because they are still navigating their own way. And the training programs actually doesn't focus on this. This is lead us to another question. Are the healthcare system ready for integrating AI in practice? Yes, this is the right question to be asked. There are many research published in Saudi Arabia and actually outside Saudi Arabia regarding this. Are the healthcare system ready to adopt AI? Are they adapting the AI? Are they preparing their infrastructure for AI? So a lot of things. So there is a lot of publication has been discussing this. So when I just navigated this, I found that there are 8 themes that has been outlined. First, the awareness and understanding of AI integrations in healthcare. Um, the actual utilization or integrations of the AI system in medical practice, the benefit and the concern, the educational gaps and the need for training, the concerns and challenge that related to different aspects. Is there institutional support? Is there supported resources? What is the need from stakeholders? Okay, and the most important thing is what is the governance policy and guidelines that actually helping you as a health practitioner to yani, act freely and confident around AI, implementing AI in your own practice to the favor of the patient, better outcome. So the practice as we go through the evidence and the publications, we believe that there is a perceived benefit and concern. Yes, most of the literature said yes. All the health practitioners, all the medical trainees, all the healthcare system understand the importance to augment their own practice with the artificial intelligence applications. And there is a concern. Okay, it still has been raised. Are there a good awareness? Yes, there is a good awareness about this, but they ask for more deep understanding. Yes, we are aware about different technology, different opportunity that could be implemented, but actually we don't know about how we can analyze the report that coming from AI facility. Again, how to communicate this to the patient, how I can read this report and inform my own decision, how I can critique this report and just make sure that the data that's given actually is valid, is reliable. So this is the things that I need to understand it. I know about it, but actually I didn't try it before. And the most important things, yes, we know that there is a lot of AI applications, but actually it's not being implemented on our own surface, in our own facility, in our own teaching hospital or hospital. So this is one of the actual, this is how describe the practice. The need, they're asking for a training, awareness, and we relate later on we'll talk about the awareness indeed. But a training to utilize this AI in their practice, build their own decision, clinical decision, patient plans, promotion, okay, based on the evidence that they have from the AI. They need to see a collaboration between different stakeholders, and they need a clear policy and guidelines to oversee the AI applications in health practice. The challenge about ethical issue related to patient confidentiality, related to um, patient confidentiality, equity, things like that. And the professional identity, the afraid of losing their some of the specialty after to be replaced by the artificial intelligence, and the reliability of AI system. Again, one of the challenge, the institutional support, the leadership support, the system, the infrastructure support with the limited resources. This is a big challenge to implement AI. So what about, this is in general, so what about the in Saudi Arabia? How we read the scenario there? So the challenge in healthcare, challenge of integrating AI in healthcare was really clear. First of all, the Saudi Vision 2030 aimed to professionalize the healthcare sector in general by incorporating advanced technology, that including AI, to enhance the service delivery. So we have different national initiatives that promote implementing or supporting or fostering utilizing technology in healthcare, especially the AI. But we have two challenges with these initiatives. One, the facility. Yes, many initiatives has conducted, but still we have facility challenges that to implement. For example, the unified medical record. How many of the hospitals have unified medical record? And are the record really has been utilized to be a complete record? Are the data getting from this record are efficient? So it's something not about initiating the project, about implementation, assessing the data coming out of the project. So this is one of the challenge. The second thing is expertise challenge. We noticed that yes, we have different initiatives, still we face a challenge of not having expertise. Most of the healthcare professionals are like the simple adequate training in AI technology, which is really essential for effective implementation. So this is regarding the national vision. But we find that, again, as Al-Hassan said, that the regulatory body and policy making framework is absent, and that one of the things, hesitating most of the most of healthcare professionals who are really have any good technology, AI technology to be integrated in their own practice. So they need a policy to to oversee their own practice. Uh, Many literature has been described the resistance of change, and this resistance of change coming from institutes and coming from individuals, and that related sometimes to the institute cultures and environment, and sometimes it's coming to the cultural background of the peoples or the institute itself. So this is one of the things. And again, the infrastructure. Sadaya said in 2002 that, however, we supporting as a national, one of our national target outcomes, to have more, okay, a report by Sadaya, the Saudi Data for Artificial Intelligence, pointed out that many healthcare facilities lack the basic infrastructure required for high-speed data processing, which is really essential for AI technologies. So this is the major scenario in Saudi Arabia. So to conclude, we have initiatives. Okay, initiatives is still facing some initiative plans, facing some communications regarding infrastructure and resources that need more training, that need to lose the change, that need governance policy and governance policy and regulatory body to motivate people to implement AI in their own practice and support the technology. Again, if this is our own system, so are our own physician ready for this era? And I take you to this question. So please answer this question by taking this poll. Are physicians adequately prepared for the integration of AI in healthcare? We can say that most of the physicians are highly trained and fully occupied to incorporate AI in their own practice. Or most physicians highly trained and fully occupied to incorporate. Anyone more to take this survey? Okay, so يعني mostly most of us agree يعني 6 من 8 agree that in most of position willing but need the appropriate training, suitable incentive and support. How they are trained? That question. Okay, to go to go back again. So um,
Dictora Prof. Rania, also there's a few questions. Maybe you're going to go into the second sections. Maybe Dictora Shazia wanna read the questions put in the question and answer. Go ahead, Dictora Shazia.
Yeah, there are questions in Q&As. If you see, Dr. Muna Sheikh asked that, how do you see the roadmap of effective incorporation of AI in healthcare? Should it start in universities, MOH, or regulatory bodies? Please enlighten us with the vision of ideal process in this perspective.
yeah, this is a really important question, and since it's come from Prof Muna يعني أكيد أكيد إنه it's the question. Actually, it's the conclusion of this webinar. It's about this. Who should act first? يعني is it the training center, training leaders, or we need authority to make the first move? So which one in the chessboard supposed to move first? And this is the questions, and I hope I can answer it by the end of this. But I hope I can answer it by the end of this webinar. But yes, this is actually the conclusion of the webinar. Thank you, Dr. Ramona.
Okay, so we shall wait till the end. Maybe we
Yeah,
find
yeah,
solution.
this will be great.
Same way, Dr. Masood Javed question is also similar kind, like any change in competency framework suggestive due to AI. So just
Yeah.
highlight by the end that is there any change in Saudi competency framework for graduates or undergraduates? Dr. Kareem Saleh has mentioned that is the doctor-patient relationship would be challenged in AI area.
Yeah. Yeah, it's challenge. It's today without application. And in the current practice, we don't apply most of the AI applications in their own in daily practice, healthcare practice. Okay, it's still communicating with the patient gets harder every day because the patient come with the patient today is not the patient 10 years ago. They're coming with a lot of readings, a lot of ChatGPT يعني advice, okay, and diagnosis, and so they are coming with a lot of questions and sometimes evidence and sometimes papers, okay, and try to convince them. And you have to accommodate their need. They have to accommodate. So actually, it's a big challenge, and in application of AI in technology, application of AI technology in healthcare, it would be يعني a more challenging one. The important things are we preparing our own graduates for this kind of challenge. يعني in the medical schools we do the simple one يعني اللي هو communication with the patient, sometimes difficult patient, but that's all. But يعني I never seen in one of the OSCE station, for example, patient coming with to the doctor with papers and try to show just educate me about this paper because it's about my case. Yeah, and just explain for me the simple result. So yes, it's harder, and it will be get harder, and we will need to prepare our students. The other questions regarding to the framework, yes, I believe يعني this is the question to you. إنه is this competency that we saw before, is it enough to have this kind of graduate? يعني, in a simple way, are these covering what is required by today's tomorrow's doctor? Okay, what do you think that they need to do more? And this is the question. Yes, there is a need to change some of the framework and to incorporate this. And the question is there any kind of initiative has been started in that road? Yes, there are many, and we will present these initiatives. But to start with, are our student graduate, our student, medical student in general, or health practitioner in general, ready? So from the literature, Saudi literature, we find that general awareness of the importance is really high. Okay, so general awareness, general awareness of the importance of integrating AI in healthcare practice is really high. It's reaching about 80 to 70% of respondents in most of the study. This is just a sample العمري والبدعاني. Okay, utility of AI. Okay, one of the study by Al-Qahtani said that only about 40% they never use AI in their practice before. 22 they said rarely, and 31 they said sometimes. So it's really, the utility is not being utilized in the current practice in Saudi Arabia, mostly from this study and other study have resemble the result. Uh, about the literacy, AI literacy. So a study emphasized that the law of level of literacy and lack of technical competency within medical field, and this has been presented in many studies. Okay, one of the study by Wadani said that about 40% or 38% understand the basic computations principle of AI. And the basic we need that just to figure out how this data or how these outcomes come, which input you put there. Okay, so basic computations principles. The literature said that there is a raised concern about the imbularity concerns. Okay, many studies discuss that integrating AI in the healthcare practice raises a concern that someone will lose their jobs by replacing by machines and technology. And that was really interesting, and it presented not in Saudi, in worldwide. However, some studies said no, actually there is a low perceived concern regarding their job loss, about 90%. Okay, and they found a 55 most of the respondents believe that actually the AI implication adaptation in healthcare will provide a new job, a new position. Okay, and what is the difference between these studies? I believe one of the differences could be the awareness, the level of awareness where this study has been conducted. What kind of introductions or preparations or training or adaptations of AI, level of adaptations of AI in healthcare uh, uh, facility it will be. Okay, we have a professional concern also regarding, for example, ethical issue, patient privacy data credibility, data reliability, the ethical considerations about equity and things like that has been raised in some of the literatures. And when we go back to the most of the raised concern, why we have concern? Because there's a challenge. Okay, or because there is something that called new unknown. So having more awareness, disseminating the knowledge, showing an experience, showing the importance, training, disseminate awareness will help to minimize these concerns. Finally, the need for training. All the study agree that there is a need for training, and nobody can argue about this. There is a need for training. But the interesting things here, not just about need of training, we found that the people who trained report better understanding of AI in clinical practice. They have a positive attitude regarding AI. Also, they have a greater confidence of using AI tools and facilities. So that means the training improve the awareness, improve the readiness, and improve the adaptation. This is going back to our own frameworks. So are the frameworks alone helping us to create this kind of competent doctor today in the era where the AI has been integrated into clinical practice? No, the question is no. Is not enough. Okay, we need a training, we need a support, we need a clear guidelines, and this is the answer for Dr. Raman. Yes, we need a training that's coming from the medical school, we need a support coming from the health facilities, okay, and from the governmental level, and we have a governance guidelines that's coming from the decision-making agencies. We need a skill we need this, the competent physician in today, in the era of artificial intelligence, need a skill to evaluate new technology. Which technology most applicable for me? I can choose from these the best one that fulfill my need and answer my question. They need a skill to make interpretations for output from the AI, understanding the source of error, that is really important, and bias. Okay, so this is really important to evaluate the data given. They need skill to communicate AI facility outcome result to the patient, to their colleagues, to the public. They need a skill to advocate for health, for ethical considerations about equity, about patient safety, about patient privacy. So they need this kind of skill. This is kind of skill supposed to be taught, trained within the programs. So medical student and resident need a blend of technical, clinical, ethical competency to be effectively address the challenge of and opportunity of presented by AI in healthcare. In this aspect, so we can see the AI as a silver bullet, and most of the people not agree with me, but it's a silver bullet. It has the potential to solve many complex challenges in the field, but it has a promising and misleading side. So the promising side, when we have the good infrastructure, the trained manpower, okay, and the system that governs this. And but misleading component, when we don't have a good candidate, a good health professionals who are competent to handle this data coming from AI. Okay, so sometimes they base decision on biased data coming from AI. They don't judge, they don't review, they didn't choose the right supported decision. So in the era of AI, when we see it as a silver bullet, has different side, okay? We have to mapping practice process. That means we have to map the practice process flow, okay, and the pathways in the country, in the healthcare system, and to choose tailored solution that's supposed to fulfill our own needs in this system. We have to support the infrastructure around this, okay, and the most important things, support the required manpower, trained manpower, competent manpower to support this AI. By this, we have the good and positive side of artificial intelligence application of AI. Here, we're talking about training and education. So why the training is really important and why today? Integrating AI effectively into medical training program is really important because it's time to recognize change. Yani 2020 with the era of COVID-19 was an opening eye and everything has been done يعني كده tremendously بسرعة. Okay, and it was a transformational phase in the healthcare system. يعني أول مرة نعمل the first time that we initiating a telemedicine clinic, okay, اللي هو virtual clinics. And it works. It works. Okay, and we get surprised, but actually we didn't have this choice, because if the physician has a choice, he said, no, I need to communicate with the patient face to face. But actually, when the time of crisis, we managed to do this and we succeed. So it's time for change. The healthcare leaders, the program leaders, they have to understand it's time for change. Okay, we don't need another crisis that make us going into that direction. So we're supposed to be prepared in advance. we knew it for a new skill, the presented skill يعني before, okay? This is the skill that we need. We need to reassess the whole core competency. So because of the time, I have important slide I want to show you before opening this for discussion. So about what? Okay, what do we have to change in the training program? So I have some study. One of the studies about competency for, it's a study by Louis about developing a competency for AI implementation in primary healthcare. It's based on the Wiseman approach. They propose artificial intelligence competency in 6 domains. And it has different level from regarding to the learner roles, like the medical student, the resident, and the faculty member. So these domains about a foundational knowledge of AI, critical appraisal, medical decision making, technical use, patient communications. Okay, so this is one of the suggested plan, and they try to make it in different levels regarding to the role of the learners or the role of the practitioners. Are they medical student, or are they resident, or are they faculty, that mean consultant, program director? Another study, okay, develop a competency for the use of artificial intelligence, artificial intelligence for all healthcare professionals. And that in this survey, it's a national survey, and it includes dentists, physician, pharmacists, nurses, and different specialty. And this is just 6 clinical competency focused on the basic knowledge of AI, social and ethical implication of AI, the workflow analysis for AI-based tool, and AI-enhanced clinical encounter, and finally, the evidence-based evaluation of AI-based tool. So they are based developing a competency. Another study by Sarah Jacob, it was based in United States. As you know, the ACGME developed the outcome project, and they designed 13 ABAs. The ABAs for undergraduate medical schools. Another study has made survey of these ABAs around the United States medical schools, see how many of these ABAs have been assessed and implemented in their programs. And they categorize these ABAs to 3 category cluster. One, the core of the core, that has been the main focus that been investigated in all training programs in the United States. And the cluster 2, the advanced EBAs, that has been sometimes measured in some of the medical schools, not others, and some aspirational, mostly not being measured in these medical schools, including performing general procedure for a physician, identify system failure, and contribute to cultural safety, obtain informed consent for test and procedure. So Sarah Jacob now is suggesting another, a third layer. Okay, it's related to the ABAs. Okay, your proficient use of healthcare technology, understanding and applying health informatics, and finally demonstrating team skill for transdisciplinary interactions in healthcare setting. So this is what has been done so far. So they try to suggesting a framework, improving, adding more competency. So the questions back to our own Saudi made framework. Which of these competency and domains need to be improved to integrate AI in its feature? And this is taking us to a question. Maybe you help me to answer it. What skill and competency do you think are essential for future physicians in integrating AI into their practice? Please help me and write your answer, okay? And I will show you mine. Okay. All what? If you be more specific, all what? all السكيل اللي احنا قلناها أول في البداية. Okay. Professional. Okay. Any questions before I go to the last part? Dr. Ali, Doctora?
Actually, there are a few questions, and some of them has been maybe answered. Dr. Abdullah Shahrani, he said, "What about professional ethics and artificial intelligence?" And also, he had another questions. Could the Saudi Commission for Health Specialty be the umbrella for leading the artificial intelligence in the field of education and health? So he asked these two questions.
Yeah. First, the last question, Doctor, regarding to our the Saudi Commission for Health Specialty. Actually, they are overseeing the residency program. So my question for them, are the Saudi Commission addressing the artificial intelligence in their own program? If not, so why? Yani it's part of the practice. Yani in the medical school, we have an excuse. Okay, still we are building our the new graduate for the basic skill, blah blah blah. Okay, but for residency program, this is part of the practice. So if you're not prepared, or is it optional? Okay, if it's optional, why it's optional? Okay, so this is regarding to the ethical issue. Yes, يعني for example, if we as يعني a group of expertise and interested يعني professionals interested to develop يعني what is the ethical component, okay, to be addressed for يعني ال AI in clinical practice. هنقعد ونشتغل على project جدا كبير وجميل. It will be so interesting. Okay, but it's need manpower, it's need initiatives, it need someone to work in it, it need مهم. وبعدين أهم حاجة إنه it's not just to work on it, it needs to work in it and يعني integrated with another things. Okay, so yes, the area مرة كبيرة and needs مرة كبير and still the interest is still كبير, بس إنه one hand can't clap by itself. يعني يد واحدة ما بتصفق. إحنا نحتاج to cooperate to يعني redesign this in the training programs to be يعني seen probably. And this is one of the initiative projects me, myself, and Dr. Mona are working on it يعني إن شاء الله. ويعني we are in the phase of يعني implementing the study.
Very good.
So,
Also, there's another question. Also, it goes in the same dilemma about ethics and this. And one of the challenges you mentioned it earlier. Dr. Shahzad Ahmed, he said, "How does the healthcare industry address ethical concerns and ensure patient privacy when using AI tools, especially in sensitive area like diagnosis and treatment planning?" Uh, um, so. Uh,
so the
concerns about yeah
the industry يعني the industry to reach to the phase of يعني selling their own product, they are maintaining the whole the يعني all the issue regarding to the privacy ethical issues is supposed to be part of the project. يعني ال FDA أو Saudi يعني federals for ما أعرف إيه المهم won't agree to have this kind of product until they يعني fulfill all the privacy things. But يعني still يعني إحنا as a leader, okay, as a leader to implement this tool, I'm not forced to implement it in my institute if it doesn't suit my institute policy and preference and roadmap and priorities. So it's my decision. So we need those kind of leaders to be prepared to choose from these يعني industry the best thing that suit their own needs. And to do this,
okay
it needs to be educated.
very good. So Dr. Kareem and Dr. someone else there, they have their questions. Maybe it will be answered at the third part of your presentations. If not, then we're going to go back and ask you the questions they've sent
Make it
us.
sharp
So
because it is
yeah, proceed,
sake of
please. Thank you.
time. Okay, so from my own perspective, okay, I have يعني this outline competency. I believe that in what we need a technical competency to understand the AI technology, including data management, the algorithm, basic algorithm, machine learning fundamentals. Why do they need to do that? Just to enable healthcare professionals to assess the relevance and the limitation of AI tools in their clinical setting. Just a basic understanding, okay? We don't want to sit here and the salesman come and tell us something and we can't judge because we don't know about it. Okay, so just the basic information to make our own decision. Okay, really wise enough. Another thing, the clinical competency. We need to develop the clinical skill in healthcare necessary for applying or integrating AI in their own clinical practice. So how to use this ECG analysis, okay? How to use it, okay? How to use this CCD results, how to inform the patient about it. So these are basic things, how to use this AI insight in your own practice. Okay, we need ethical competency. This is really important to develop awareness of the ethical issue that related to the patient privacy, algorithm bias. Sometimes the algorithm actually is machine. Sometimes yani garbage in, garbage out. So sometimes we don't do a proper input, so we have a not appropriate output. So algorithm bias, one of the main concern. So we need an ethical competency to be developed in our own trainees. We need communication skill. We have to communicate to them how to convey a complex AI concept to by a simple word to the community, to the patient, to the colleagues, in a simple way. Okay, don't make my life harder than it is. I come for sick of finding advice. So don't tell me algorithms. I need a simple way. Just can explain a simple way. Okay, so they need to develop a communication skill. Finally, we need a professional competency, collaborations and continuous learning, collaboration with different disciplines and technology sectors, okay, different healthcare professionals, okay, and we have to maintain our own commitment to stay updating all the time, because the technology not stop today or tomorrow, it's just coming. So you have to update yourself all the time. So how to do this? This is the questions. Educators and leaders need to optimize the training environment to prepare trainees for future far different from the one their teachers have known. This is the message. So to do that, we have to have curriculum development, okay, and that include reviewing the competency, the outcomes that you are based your program on. You have to change your teaching by more hands-on experience, providing opportunity to apply AI tool in clinical setting to taking a decision. The assessment supposed to support and foster advocated assessment. The, the assessment supposed to support how we implement AI in clinical practice. Not only this, the interdisciplinary educations between different programs, between the health professionals and the scientists and technologists is really important. Ethical training is really important. And أهم حاجة, train the trainers. You supposed to be trained in this, because if you're not trained well, you can't educate your students well. Okay. So finally, what are the key priority for training program in the context of evolving roles in healthcare? Is it update competency that include AI, curriculum development, increase handling experience, advocating assessment, emphasizing interdisciplinary education, or ethical training? Okay. To conclude, as you do the survey, I will go back to it again. As a conclusion, AI augment medical practice. AI can enhance decision-making, improve patient outcome, increase efficiency of healthcare setting, and empower patients. Healthcare system must prepare adequate infrastructure and regulation to integrate AI. Strong leadership and collaborations across healthcare sectors are essential and critical to overcome the challenge that is expected. There is a limited AI curriculum frameworks, and there are lack of theoretical foundation in AI education, in artificial intelligence education. Medical practitioners and trainees must acquire appropriate competency, including technical skill, understanding, and ethical implications. So, to conclude with, a national competency-based framework and assessment plans must be reviewed to address the AI competency and requirement. This is the last part. I conclude this is the reference. If you have any questions, I will be happy to answer it.
Uh, Thank you so much. I would like to heartfelt gratitude to our distinguished speaker, Dr. Rania Zaini, for her very much engaging interactive kind of presentation, and definitely you shed light on role of AI in healthcare system, which is really very important. So in this presentation, definitely our participants, they got a chance to think what AI is and how it is leveraging healthcare competencies in different dimensions. And ethics has always been our concern, and ethical implication of integrating AI in healthcare are thoughtfully addressed in the presence of evidence-based practices. So um, now this is the right time to think how we can begin with, how we can train ourselves to adopt these technologies, as well as to practice and bring some kind of evidence in our own institutions. So as we move forward, it's very clear that AI is not about tools, it's about collaborative practices and rethinking. That's an idea. So I would close this session now. I can see that most of the questions have been answered, but still, if there is anyone pending, let me highlight Dr. Zeni. Um, One question is there by Dr. Asim, that are there any successful stories where AI has led to significantly better patient outcome?
Sorry.
Are there any successful stories where AI has led to significantly better patient outcome?
Yeah, there are many actually. I can't bring you some, but yeah, there are many. يعني, last month I attended a session by Dr. Mona Sheikh. It was presented in one of the symposium in Jeddah, and she was talking about the AI in medical educations and AI in healthcare. And she يعني, gave a shade of different examples, يعني, surprising examples. There are many. Okay,
Yeah,
but I can't bring you one to now. But yes, there are many. And no, many. For example, there are many studies. For example, investigating the using the artificial intelligence in diagnosis of X-ray. Okay, and they try or pathology slide, and they try to compare the judge with an expert, and they found that it's really so. Uh, accurate. And do you know what is a kind of artificial intelligence they use? Actually, they're using not the hospital one, they're using the artificial intelligence Gemini and the ChatGPT. And they find that more ChatGPT and Gemini are efficient in finding the right diagnosis for most of the cancers findings, but not to the advanced one. Okay, not the rare ones, but the rare one, the both have identify the differential diagnosis, the most appropriate differential diagnosis. Okay, so yes, there is a lot of history and a lot of study regarding mostly pathology and radiology.
yeah. So, Dr. Zaini, there is another question which is very much bit concern of most of the audience, that is this okay to upload patient file or patient investigation to any AI tool? Is it ethical? Like we can give
It's
this,
not. It's not ethical. It's not ethical. But when we talk about AI in healthcare, we talk about for example, the unified file system. Okay, so no, it's not ethical to exchange these unless you take it for training purpose with specific. And there is a kind of regulation regarding how to protect patient privacy. So if you take the information without the identity of the patient, it will be for education purpose, it will be appropriate. And there is a kind of guidelines to describing this.
all right. Thank you so much. I think most of the questions have been taken up, and lot of thanks are mentioned in our chat. Wow. So next upcoming, very exciting. We can't hear you, Dr. Ali.
Actually, we are in era of artificial intelligence, and we're going to bring the big guns in our country. You can see Dr. Zaini has recited so many clinical data being done in Saudi Arabia, and this is something we have to be proud of. So uh, Dr. Zaini, she talked about the artificial intelligence from one perspective, but I think we should wait for the second part of this series of artificial intelligence, leveraging artificial intelligence for medical educations. And guess what? Prof. Mona Sheikh is going to talk to us about that. And I'm sure Dr. Zaini will join us, and the debate is going to be really very beautiful as today's. And it's
Yeah,
going to be on the 14th of January. Yes, go ahead.
yeah, so I'll be pleased. يعني I attend many of Dr. Mona and they يعني I can't tell you how it's really amazing. So
Yeah,
having something after يعني مع دكتورة منى in the same theme, it will be challenging, but she win, and I'm so glad that she win.
actually, I think all we are collaborative. We are one team. And
Absolutely.
after Dr. Sheikh, we're going to have another webinar talking about artificial intelligence with Dr. Mohammed Al Mansour. He's the chairman of the Medical Education at King Saud University. So I think we are going to go a very good grasp of artificial intelligence for our attending audience. So I would like all the attendees today to distribute these brochures to their network, and we're looking forward, inshallah, for the future to help us promote the concept of medical educations by these webinars. Shazia, it's all yours to conclude.
Thank you so much for joining us today. I hope that our participants they enjoyed this thought-provoking presentation, and thank you so much for our eminent speaker. This session is being recorded, and recording of this session will be shared with the registered participants. And hope to see you on the next event, which is on 4th of January. And Happy New Year to all.
Happy New Year. Goodbye, everybody.
Goodbye.
Thank you,
تصبح
Dr. Zain. شكرا لك. إن شاء الله
على خير.
شكرا لك. مع السلامة.